Hi. Today, I'll be going over some anatomical terminology. First, let's go over the directions of the body. This is Sunny. He'll be the subject I'll be using to explain the terms with. In a medical setting, professionals use standardized terms to designate body positions and directions. This is so that physicians and technicians alike can communicate bodily descriptions efficiently and concisely to deliver better health care. For consistency, all descriptions assume that the body is in an anatomic position. In this posture, the subject is standing upright with face front, arms at the sides with palms forward, and feet parallel. The 8 main terms for describing directions in the body are as follows. Superior, meaning above or in a higher position. Opposite to this is inferior, meaning below or lower. Anterior and or the term ventral means the front of the body. Meanwhile, its opposite, posterior and or dorsal, means facing the back. Medial means more towards the imaginary plane that passes through the center line of your body, while lateral means more towards the outsides of your body. Proximal means closer to a point or origin of a structure, while distal means farther from that point. For example, the tip of your index finger would be more distal than the tip of your thumb to your wrist, since it's farther away from its given point, the wrist. Remember, proximal and distal are based on given points of origin, or joints, such as the elbow or the hip bone, etc., versus lateral and medial, which are based on the center line of your body. The body also has 3 planes that can each be cut through different dimensions. If you were to cut through the ears and through the middle of the body, that cut would make up the frontal plane. It's also called the coronal plane. Any lines with the top of your head all the way down past your body would make up the sagittal plane. If it's an even line from the middle of your body, that would make up the mid-sagittal plane. A plane that spans horizontally across your body would become the transverse plane. It can also be called the horizontal plane. There are also terms for cuts made along smaller things, such as organs or parts of tissue. Let's use Sunny's snack, a daifuku, as an example. If we made a cut perpendicularly to the long axis of the object, a cross-section of the object would be visible. If we cut the daifuku parallelly from the long axis, we'd get a visible longitudinal section. And if we cut the daifuku at a diagonal angle, we'd get oblique sections of the mochi. Internally, the body is divided into a few large spaces, or cavities, which contain the organs. The 2 main cavities are the dorsal and ventral cavities. These 2 cavities house even more organs. The dorsal cavity has 2 subdivisions, the cranial, that houses the brain, and the spinal cavity, which includes the spinal cord. The ventral cavity also has 2 main subdivisions, which are separated by the diaphragm. The thoracic cavity, which is superior to the diaphragm, contains the lungs, the heart, and the large blood vessels that join the heart. The abdominopelvic cavity is inferior to the diaphragm. This space is further subdivided into 2 regions. The superior portion, the abdominal cavity, contains the stomach, most of the intestine, the liver, the gallbladder, the pancreas, and the spleen. The inferior portion, set off by an imaginary line between the top of the hip bones, is the pelvic cavity. This cavity contains the urinary bladder, the rectum, and the internal parts of the reproductive system. It is helpful to divide the abdomen for examination and reference into 9 regions. The 3 central regions, from superior to inferior, are the following. Epigastric region, located just inferior to the breastbone. Umbilical region, around the umbilicus, commonly called the navel. Hypogastric region, the most inferior of all the midline regions. The regions on the right and left, from superior to inferior, are the following. Hypochondriac regions, just inferior to the ribs. Lumbar regions, which are on a level with the lumbar regions of the spine. And iliac or inguinal regions, named for the upper crest of the hip bone and the groin region, respectively. A simpler but less precise division into 4 quadrants is sometimes used. Thank you for watching this video. I hope it was helpful.